Who is here? Hello, Tracy. Welcome to this live. Kindly confirm that you can hear me. Am I audible? It's interesting what we go through as content creators. I'm not sure the audiences know what we go through. Okay. Okay, Tracy, is the audio very good? I want to be sure this audio is good. I'm using the lavalier mic and I have different options, but I want to be sure. I think this is good. Welcome to this live. It's a pleasant weekend. Saturday live. Let me know if you can hear me. Okay, thank you, Tracy. You say very good live. Tracy Mutembedzi. We have 3 likes already. Thank you, everyone, for joining in. I still need to confirm that my audio is very good. Do you have a very good audio? Because that's one of the very important things to get the message across today. Apart from the video, please confirm that my audio is good. It's very important for me. Mm, 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 mm. Thank you, Tracy, for the like, and everyone who has clicked on the like button. This is Dr. Soyemi, and we are talking health, wellness, and lifestyle. Okay, and I just had to look up because I was not looking at the camera initially. So this is Saturday Live, and we are discussing a very important topic today. So I want you to just settle down, and uh, I'm sure you're going to find this very, very interesting. Okay, so I can see the fourth like. Thank you, Tracy. Thank you for the love. Thank you for the excitement. Please let me know where you're joining from. Where's your location? Where are you joining this live from? Kindly drop in the chat. Okay. But I still need someone to, excuse me, to let me know if my audio is very clear. Is my audio audible? Is my audio audible? So how is your weekend going? Let me know if you can hear me. How's your weekend going? I need your feedback on this live. Okay, so if you have ever had a headache, I'm sure you know what that means. Something unpleasant, a symptom that most people get to have at one time or the other in their lives. So, but we are looking at the different aspects of this, talking about a headache. It's a physical symptom actually, and it's not really, even though it could be a diagnosis, but it could be just a symptom of some medical condition. Okay, so if you have ever had a headache, let me know in the chat and how you felt or how do you feel when you have a headache? And then can you describe your headache? I mean, if you have been having recurrent headaches, can you describe how how it's been? Okay, definitely it's not been a pleasant experience. This talking about abnormal sensations in the head, and it could actually be in any part of the head. Could be in the frontal aspect, could be sides by the sides, could be the back. It could even extend to the neck. Okay, it may even affect the eyes. So it's a common symptom, affects people globally, irrespective of sex, age, socioeconomic status, irrespective of race. Okay, so this is one thing we all need to know. I want to be sure. Let me know if you can still hear me. Okay, I believe I'm still audible. I just need that feedback. Oh, thank you, moderator, for handling that inappropriate message by someone. Okay, so we are talking health, wellness, and lifestyle, and this is a community of health enthusiasts, and there's something that is common to every one of us, irrespective of age, irrespective of sex, irrespective of race. And I can see that we have quite a number of people joining this live from different parts of the world. And I can tell you that people on this live at one time or the other, at least one person has had a headache. Okay, okay, and then it's not really race determined. Okay, but there are many factors that could cause a headache. So as I was saying, it's an abnormal sensation in the head, and it's a message actually to the individual having this symptom that there's something wrong. Just like pain in any part of the body means there's something wrong. So we need to find out what could this be, okay? And many people tend to want to treat the symptoms rather than identifying a cause and getting to make a diagnosis, okay, and getting appropriate management. Okay, so if you are going to be dealing with your headaches, recurrent headaches, or even occasional headaches, then you need to be part of this discussion. You need to pay attention, close attention to this live. Thank you for the likes. I'm sure you can also share this live with your community, with friends and family, because this is a very important topic, and then we need to look at this together. Okay. Um, in terms of the frequency, some people have this symptom more frequently than others, and there may be different reasons for that. Okay, it's actually one symptom that may be responsible for absenteeism from school, from work, and it could actually amount to loss of quality manpower. Do you work with a team? Have you worked with someone before that has actually had these recurrent episodes of headache? Or you may actually be on this live and then you are having this particular challenge. Okay, so you can definitely talk about how it has robbed you or deprived you of your effectiveness in different aspects of life, whether it has to do with your business, it has to do with your profession, it has to do with family time. It could affect a lot of things, even your social life. Okay, so this is a very important topic. You know, that is uh, that is actually an understatement. Now I'm trying to look at the chat. I can see Bossede Joseph is here. Hello, Bossede. Hello, Bosse. Welcome to this live. Saying hi, Dr. Soyemi. Okay, thank you for joining. How is your hand? How is Saturday on your side? It's a pleasant weekend. I hope you are good and family. Well done on your content creation on YouTube. So I was saying that many people do not actually know what it takes to create content. It takes a lot. It takes a lot of sacrifice. It takes a lot of time, attention, commitment, discipline. You know, if you're a content creator, I'm sure you will agree with me that it takes a lot of effort, it takes a lot of commitment, it takes a lot of discipline, it takes passion, it takes having a vision, it takes wanting to help others, it takes trying to go beyond yourself to uh, do something for your world, maybe in your space, but the YouTube platform has given us opportunity to reach out, reach uh, people from in different parts of the world. Okay, so it's a great advantage, and we must not take it for granted. And interestingly, last week we got the channel monetized, and then we celebrated it. But to me, it's actually more work, more more expectations, and then the need to meet up with the demands. I do clinical practice of medicine. I'm a family physician, and apart from consultations with patients, physical consultations, online consultations, public speaking, primary surgeries, it's a lot of work. So sometimes you see some gaps in video uploads, and I look forward to the time that I will be a bit more consistent with uploading videos of your interest. We have various interests, and we'll definitely be looking more into that. So I believe it's just the grace of God that we have received, I have received to do this, and I won't take it for granted. So I will build myself more, find out more ways to do this, invest more in making quality content. So thank you for your attention. And I can see we have members of the community joining in. You can see Oluwatomisin. Okay, thank you for joining in. Welcome to this live. I want you to confirm that this audio is very good. Very good. Are you comfortable with my audio? Saying good morning, Doc. Good morning to you, Tosin. Well done, our content creator, and there are many others here. Well done on all you do. Okay, so we're talking about headaches, and it's actually something that may be commonly found in content creators. Talking about people who are on YouTube, people who are on TikTok, Facebook, Instagram, and other social media platforms. Okay, and we'll be talking about why that can happen. Of course, you know. Okay, Tomisi says, very good. Thank you for the feedback, Tomisi. Thank you for the feedback on the audio. Okay, and then you say, thank you, sir. Welcome, Tomisi. Good to have you here. I'm always excited to come on your live and every other person. And, when we come together, we connect more, we learn from one another, and it goes a long way. So we are talking about headaches. So there are different types of headaches actually, and then I'll try to break them down as much as possible. Basically, like three major types. Talking about tension headache, which is the most common type, and then talking about migraine headache, which many people know about, and then the cluster headaches. Okay, the tension headache is sometimes like a band around the head, and usually may be related to stress, anxiety. Those are some of the causes of headache. We'll be talking deeply into the different causes, but I'm talking about the types now. Okay, so that's the type, and for this kind of headache is the most common. Like I said, it's said that about 60 to 70% of headaches are actually due to tension headaches. Also, migraine headaches, which you may be familiar with. The other one talks about a band, but the migraine is usually unilateral, one-sided. Sometimes it could be on the right side, and so other times it could be on the left. Okay, this kind of headache may be throbbing, and it's actually related to stress also. It could be triggered by stress, some types of food, some chocolates, some caffeine, and different factors may be responsible for this. It could actually be genetic. Yes, it could be genetic. That's if someone in the generation has had it in previous generations, then an individual may actually have it. It doesn't automatically happen, but it's a possibility. So in this kind of headache, I'm sure if you know someone who is suffering from a migraine, sometimes they talk about that sided throbbing. Sometimes it could be very severe, and it could cause like tension. Tension could also cause some bit of uh, eye aches, but more commonly in migraine headaches. Sometimes may be relieved by rest, but more often than not with medications. Okay, we'll still talk about various treatments. So individuals may also have tearing, may feel like vomiting, like having a nausea, and actually vomit. Okay, there are actually different factors that may also trigger this. Lighting is a factor. So that's why sometimes individuals with that kind of a headache may complain of pain in the eye when there's light on the eye. Okay, when they're not able to actually look into light. So that is one trigger. Some food substances, I mentioned chocolates, I mentioned caffeine. People who smoke, these are alcohol, can also trigger uh, this kind of a headache. Sometimes it could last for hours, it could actually also last for days. It could actually be recurrent as long as the factor that is triggering it still exists. Okay, thank you, Tommy Singh. I'm looking at your message now. Say thank you for always showing up, sir. You're welcome, Tommy Singh. Thank you, thank you, thank you so much. I can see Olubumi Oshibajo here. Thank you, Ma, for joining in. Welcome to this live. Saying hello, Doc. Thank you, thank you. Please, if you are joining this live, let's know where you are joining from. Where's your location? And what time is it? I like to ask that because it helps a lot to actually program things, and as part of analysis helps to take decisions on how to show up sometimes and how to focus this content and videos. So thank you. So I was talking about migraine headaches. Then I'll talk about cluster headaches. Very few percentage. For migraine headaches, about 15% of headaches are due to migraines, while for cluster now, maybe 1 to 2%. The cluster headaches could just happen, could just start gradually. It could also be um, acute, but it involves one side also. It's unilateral and also involves eye ache. It actually begins with eye ache, that type of headache. So when you see a person complaining of eye ache, by the way, of all I'm saying, I'm giving a general information, but for your specific diagnosis, you will definitely need to consult with your doctor. You will need to consult with your doctor. Okay, so but for cluster headaches, it could happen in for hours, going beyond minutes. It could even last for days, and it actually has certain times of the day that it could happen. For some people, it could be in the morning, some others could be at night, and it could also be triggered by stress, anxiety, emotional disturbances. Okay, so these are the different types of headaches. And there are other types that I may not be able to mention at this time or capture in this, but as we move on in this discussion, I'm sure we'll be mentioning more. So what do you know about headaches? Have you had a headache before? I'm sure somebody here has had a headache before. How did you feel? How do you feel when you have a headache? Have you actually presented uh, to the hospital for a headache before? Okay. On this side, I can mention that one of the causes, and I'm going to be talking about causes now, causes of a headache. When somebody has abnormal sensations in their head, and then it could be it's actually a form of pain, it's a sensation that there's something wrong. Okay, so but there are many causes, there are different causes. It could be due to, I'm going to use a code, it could be due to trauma. For example, if someone hits their head on a wall, definitely they will feel pain. They could develop a headache from that. Okay, so that's one cause of a headache. It could also be due to tumor. That's in very deadly cases, although that does not mean deadly in the sense of deadly, but having a tumor in the brain may require a surgical intervention. Okay, so if somebody has a growth in their brain or in any parts of the head, it could develop into, pardon me, I want to ensure that this lighting is maintained. Please let me know if you are with me. Are we together? Kindly drop a chat. Let me know if you can hear me. Let me know if you can hear me. Am I still audible? Am I still audible? Thank you for the 8th like, okay? Thank you, thank you. I appreciate it. Remember, you can share this with members of your community because it's a very important topic and area of interest for everyone. And you may be helping somebody today by sharing this. Okay, so I was talking about different causes. I mentioned that it could be due to trauma. That's trauma to the head. If somebody hits their head on a hard surface, on the wall, or someone hits them with an item or something, then that person may actually develop a headache. So it could be related to uh, the muscles, the bones, and other structures, the nerves, and the the arteries in the head. Okay, so that's one. Then two more. That's talking about a growth, abnormal growth in any part of the head, whether in the muscles, whether in the bones, or within the brain itself. Then an individual may actually have headache. And this is actually one cause of recurrent headaches that has some other factors to be considered, red flags. I'll still mention that later in the course of this discussion. Okay, so another uh, thing that could be responsible, that could cause a headache is uh, an infection. If an individual has an infection, when I say infection, it could be infection in the brain, talking about meningitis, for example, which is common in this part. I'm talking about the northern side, northern part of Africa or Nigeria, to be specific. Meningitis is common. And then if the individual also has infection globally, talking about encephalitis, and then talking about any form of infection. It could even be malaria infestation. It could be due to malaria, which is common on this side. Okay, so that's also a symptom. So having a headache is not actually a diagnosis, even though it could be a diagnosis, but most of the time it's a symptom that has a diagnosis attached. And so there must be proper investigation to identify the cause of the headache, and then the treatment will be directed at that cause. Okay, I believe you are following me. Okay, so I've mentioned, if you are, let me know in the chat. Okay, if you are just joining us, we are talking about headaches, we are talking about types, we are talking about causes, we are talking about treatments. Definitely we'll talk about home remedies. Okay, so the next point is related to the first. I'll talk about neoplasms. Could be a tumor, a benign tumor, but it could also be a cancerous tumor, abnormal growth that could affect different aspects, different parts of the body of the individual. So I'll quickly mention that for trauma, for example, in trauma, an individual that has a trauma to the head likely may bleed without, externally, or bleed within the skull, and that's the brain. Now, a blood vessel may rupture, and then that could also trigger a headache. Okay, and I need to also mention that even with a tumor, an abnormal growth in the brain, individual may also have other symptoms associated. That may include vomiting, and then individual may have a loss of appetite. Individual may actually have unintentional weight loss. That may also happen. And there may also be loss of stability. The individual may have difficulty walking, depending on the area of the brain that is affected. So these are red flags for really consulting with a doctor if you have a headache or know someone that is having these symptoms I've mentioned. Okay, so but in terms of infection, when there's an infection, uh, I mentioned malaria on this side, infestation, there could be a fever associated with the headache. There could be body pains. And in case of meningitis, the individual will not just have a headache, may also have some symptoms which may involve the eye. Excuse me. Let me know if you can still hear me. Am I audible? Am I audible? Okay, trying to stabilize this. Stranger me, doctor. I have a doubt. Will you clarify what's the doubt? Urethral sound. Okay, I'll note your question. Uterine. You mean is it urethral or uterine? Do you mean urethral in terms of where urine passes, or you mean the uterus? You mean urethral? Urethral sound. Okay. Let me know if you can hear me. Kindly confirm in the chat. Trying to adjust this. Please confirm that you can hear me. I just need. Let me know if you can still hear me. Am I audible? Am I audible? Okay, hello, show author. Welcome. Thank you for joining this live. Remember to double tap on your screen to like it. I'm sure you can share this with others. We're talking about a very important topic. Very important topic. Talking about headache. We've been talking about, I gave an introduction and we've talked about the different types and then the different causes. That's where we are right now. Okay. But I need you to confirm that you can hear me. Thank you, Echo Bliss. Thank you, Echo Bliss. Thank you for subscribing. Okay, loud and clear. Yes, I was expecting. I needed that feedback so that I could. I'm sure that everyone is hearing. Okay, so thank you for the feedback. Okay, so I'm talking about other causes of headache now. Other causes. We talked about the different types. We talked about the uh, causes beginning from trauma, tumor, infection, neoplasia, and then some could actually be due to uh, a genetic factor. Genetics, I've mentioned that genetic factor. There are some other lifestyle factors that could be responsible, like the type of diet an individual engages in. There are some food types that can cause an individual to have a headache. Okay, some chocolates, some people who are used to taking caffeine, even though it said that moderate intake of caffeinated drink is okay, but in some instances, it could trigger a headache. And then the fact that some people actually smoke, alcohol, these are other causes. Then I will talk about some medical conditions. There are certain medical conditions that definitely may make an individual to have a headache. And one, let me remove this. One very common one is hypertension. Even though hypertension seems to be called, is actually called the silent killer, right? But when an individual or people tend to have symptoms, most of the time they have a headache, there's a pressure built up in the body and could also happen in the brain. So individuals may also come up with complications. So a person may have a severe headache, and that severe headache is a signal that the blood pressure is severely elevated. Okay, so there's something that we call hypertensive emergency, and that in that situation, the individual may have some organ damages already happening. May be related to the eyes, may be related to the kidneys, may be related to inability to move different parts of the body. So an individual with such a headache may have these other symptoms that would point at elevated blood pressure. Of course, the individual may have elevated blood pressure. In some instances, may not have elevated blood pressure. It may be a known hypertensive, it may be in a newly diagnosed hypertensive. Okay, so those are other causes of a headache. Another medical condition that can cause a headache is hypoglycemia. Okay, patients who are diabetic sometimes tend to some tend to avoid eating as they should, and then this may tilt them to having hypoglycemia. That's low blood sugar. That's what I mean by hypoglycemia. That's the medical term. And then the fact that they are on medications, for example, an individual on medications for blood sugar may also use medications, and if they are not eating appropriately or adequately, they may also suffer from low blood sugar, low. When the blood sugar begins to go lower than 70, going to 60, that is coming lower than normal. So it should be above 70 and then not go beyond 120 or 120 or 125. But when the person has a fasting sugar of 126, then they and above, then they may be talking about having diabetes. But we're not talking about diabetes, we are talking about a headache. Headache can also arise from a person having low blood sugar. Okay, so that's another cause. Of course, hunger symptoms, hunger pangs, such individual may also have a fainting attack. Before that happens, there may be dizziness, there may be uh, nausea, they may be vomiting. The individual may eventually go into a coma. So when a person begins to complain of a headache, especially someone that has a medical condition, then we need to check appropriately. Oh, okay. Let me read the comments. I welcome everyone once again for joining this live. I want to be sure that you can still hear me. I'm doing urethral. Okay, stranger me saying says I'm doing urethral sounding by using an instrument and I didn't properly sterilize the instrument. Okay, let me read it from here. He said, Doctor, you have a doubt. Okay, you have a doubt and you want me to clarify. By urethral sounding, what are the risk? Urethral sound. Various risks from trauma to the urethra can cause bleeding, of course, trauma to the urethra. And then that's still talking about the short term. There could be bleeding if the instrument is not appropriately placed. There could be bleeding. There could also be uh, perforation as piercing of the urethra. And some people may react to certain substances used in preparing the materials or any injection that is given to the individual. And in long term, have a stricture. That's like after there's a breach in the urethra, if there's an injury, urethral injury, then there could be a breach that's um, that's the attaching of the epithelium together, epithelia, so such that the individual will not be able to pass urine. So that may be a complication. Say you are doing urethral sounding by using an instrument and you didn't properly sterilize the instrument. I use again the same instrument, but I didn't share the instrument to anyone. Is there any risk? I didn't get that. Use the same instrument for yourself. Of course, because the environment is filled with different organisms, viruses, germs. As long as the instrument is exposed, definitely there's a risk of infection. When we talk about human immunodeficiency virus, that's HIV, there are different risks associated. There are different ways individual can contact that. Blood transfusion, sharing of sharp objects, and all. Especially, we are talking about someone coming in contact with another person's blood or fluid that is already contaminated, infected person actually. So if you say, is there any risk of causing HIV? It all depends if that instrument has come in contact with the blood or fluid of an infected person without being sterilized. Okay, so I believe I've answered your question to an extent. Okay, so that was just trying to address your concern, stranger me. Thank you for the question. Wake your author says congratulations on your monetization. Thank you so much. Thank you. Thank you. Thank you so much. Thank you. Echo Bleach 5150 says, hey doctor, I'm your new subscriber. Welcome. Thank you. Author says loud and clear. Thank you. Sir, your voice is low. Tell loudly. Okay, I will try to raise my voice and I hope you can check your device also to increase the volume. Oyeye Ajala, our chief baker, is here also. Good morning, doctor. Good morning, Madam Ajala. Welcome to this live. So Echo Bleach says, yes, no problem, doc. Yeah, thank you. Thank you. Yes, doc, you mean. Welcome to the community. Thank you for joining in. Stranger me, I think I've actually responded to your question. I believe. Stranger me, I believe I've replied. Then Echo Bleach says, Echo Bleach 5150 says, I turned on the notification bell so that you can assist me every time you go live. How do you mean? Okay. Okay, so you can get notifications and be part of the session every time. So thank you for clicking on the notification, setting it right so you can get notified when I come live or upload a video. Wake your author says tiredness. Well, okay, are you talking about symptoms? Yes, tiredness, symptoms. Maybe someone that has hypoglycemia may have. Apart from the headache, tremors, shaking, shaking of the hands or fingers of the body. At that time, the blood sugar should be checked. So we're still talking about causes of a headache. Dave says double tap, guys. Kindly for our own brother. Thank you, Dave. Welcome, Dave. Welcome to this Saturday live. And Dave is taking notes. Yes, Dave. Very important. We are talking about headaches. Headaches. Have you had a headache before? Hmm. Have you had a headache before? Dave says, greetings, beautiful family. The Wakeshaw saying, Dave, greetings. Dave replying. Stranger Mrs. Thank you, doctor. You're welcome. You're welcome. 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 Thank you. Please be free to ask your questions. Even though we are talking about headaches, but I'm sure you may have related questions or questions outside of that. So I will gladly take your questions. Um, Straight Jam is asking how many hours HIV survive outside the body like plastics. Okay, like plastics, I don't understand that question. Okay, but within minutes, hours, depending on the surface that the 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 fluid or blood is, the virus cannot continue, okay, to survive, okay, especially where there is heat, form of radiation. Okay, so there are different things to talk about when it comes to HIV. All right, so but let's not uh, lose focus on the topic. Of course, you can still drop your questions. I will attend to them. For Chair Africa, welcome. For Chair Africa, welcome to this live. Thank you for joining in. Okay, so another thing that you need to note about headache, I mentioned hypertension being the cause, low blood sugar, sometimes even high blood sugar for some people may be associated. And then high levels of cholesterol could also be a cause of a headache, you know. So, but that's because these vessels, blood vessels, may be clogged by those fats, and then individual may have some challenges with flow of blood, and this can actually predispose to headache. Another factor I'm trying to remember is medications. Yes, medications. Also, there are some medications that have side effects, and then their side effects may be headache actually. So when you are on certain medications, you do not have any other symptom, and you finding out, for example, for hypertensives, amlodipine is a common one. Some people nifedipine. Okay, so these are reasons why you should see your doctor for a proper review of your medications and proper evaluation to determine what may be responsible for the headache that you may be having. So basically, we're looking at these secondary causes. Okay, secondary causes. Now we will definitely be looking at different ways to manage a headache. But before we go there, do you know that one very common, there are some other common causes of headache? I will mention stress. You know, any factor, whether it's physical, whether it's emotional, mention it. Whatever it is that causes an abnormal a displacement from your normal personality. Maybe you are disturbed in your mind, maybe you are more engaged in physical work than you were before. These are things that can trigger a headache. So because the body has a way by which it functions. So when it's stressed, there are hormones that are actually secreted that may trigger a headache. You know, sometimes muscles are stretched, and then nerves begin to receive sensations that they pass to the brain. Okay, so these are other causes. I mentioned stress, anxiety. Then, of course, we need to talk about computer vision syndrome. You know, that's talking about exposure to lighting from our screens, phones, especially. Do you know that there is actually a distance? I need to confirm that distance now, that you should have your phone before your eyes, and there are different ways by which you can protect yourself, you know, whether with your recommended glasses, you know, Blu-ray glasses, anti-Blu-ray glasses, so that you can uh, protect your eyes. Eye strain is one of the causes of headache. So some people may even have some form of visual impairment that will require proper medications. So they could also have a headache. So you need to check with your doctor to identify the cause of headache. Stranger Me says, Doctor, you are very humble and honest. Okay, thank you, Stranger Me. Thank you. Thank you for your comment. Doctor, kindly advise on clenbuterol. Is it good? No danger. Using it to reduce size down. Okay. We'll definitely look at these other questions. Okay, talking about the fact that uh, people have a headache from different for different reasons, for different causes. Then we need to identify the cause, then treat appropriately. So if somebody is actually stressed, that means there's a need to rest, relax. Okay. And when you do, definitely you get relief. There's sometimes that people don't actually need medications. It may just be to ensure that they get good sleep. So insomnia, yes, I need to mention that it's one of the causes of headache too. When an individual is not able to achieve or even sustain sleep, that may also cause a headache. And then not sleeping up to for an adult 6 to 8 hours, and then also um, some other mental, I will mention mental health conditions like depression, some some people alcoholism, and different things that can also affect the brain, can trigger a headache. So I'll quickly look at my notes. What are the things that you can do? Definitely, we need to consider lifestyle modification. I talk about diet. If you're able to identify that there's a particular food that you are taking, and then you get this symptom of headache around that time, then you should be able to withdraw that possibly from your diet, okay, and see whether the headache will stop. Of course, caffeine, smoking should be stopped. I mean, people who have triggers from that. You also need to engage in regular exercise, okay, that's beneficial. You need to practice stress management, through deep breathing, through meditation, and these are very important ways to handle headache. Of course, there are other things that you can do, natural remedies. Now you can use cold compress or warm compress, depending on what suits you. You can apply warm compress to your eye closed. You can apply whether it's cold compress to the neck muscles. These are ways by which you can uh, take care of yourself to treat a headache even at home. Now, do you know that there are some headaches that are triggered because of some other abnormalities somewhere else in the body? Okay, if you have heard about cervical spondylosis, that's abnormal bone alignment in the neck, of the bones of the neck. Individuals with that may also have a headache. Okay, so headache may also occur because a person is having an abnormality in their neck or neck bones. Okay, so that's very important. Relaxation techniques are very important. Let me be looking at other other remedies for headache. So, by the way, you can drop your questions in the chat and share your experience with us if you ever had a headache. We talk about the types, we talk about tension headache, we talk about migraine headaches, talk about cluster headaches, we talk about the different causes of a headache and why it's important to consult with your doctor when you have a headache, especially with red flags. For example, headaches that occur early in the mornings, recurring, and then with nausea or vomiting, maybe headache that is associated with abnormal uh, gait movement now, or inability to even move, uh, certain parts of the body, whether it's the hands or the legs. Okay, so the important thing to note is that all depends on the cause, and then it's been said that dehydration is actually another cause of headaches. So drinking plenty of water may be helpful, will actually be helpful. Coconut water is said to also be helpful. Then some essential oils, yes, peppermint oil can be used. You can apply them to the temples or the area where you are feeling the pain. Lavender oil can be inhaled. This helps to relieve stress, helps to reduce stress. Okay, so a small cup of coffee, they say, can help as caffeine constricts blood vessels, but you need to avoid excessive caffeine to avoid rebound headaches. Ginger tea, if you love ginger, let me know in the comments. Ginger has anti-inflammatory properties. Ginger can ease headaches and nausea. Magnesium-rich foods like nuts, groundnuts, seeds, bananas, dark chocolate are also very good remedies for headache. Some people have talked about acupuncture. Say between your thumb and index finger, you can press gently for a minute. That takes care of tension headache. Maybe you try that acupuncture. Now, proper rest in a dark room. For example, if you're suffering from migraine headaches, you need dark, dark, dark room, and then quietness, because noise is one of the things that triggers migraine. Herbal remedies, feverfew and butterball. Okay, natural herbs that may reduce migraine frequency. Okay, some people are actually uh, doing well in preparing some herbals, but you need to definitely consult with your doctor if you're going to be taking anything um, outside of the orthodox. Reduce stress and screen time. So finally, very important. We need to learn to take breaks in between screen, viewing screen, working on our laptops, desktops, tabs, phones, and also this will help to avoid eye strain. I believe we've had a good one on this topic. If you have any question, you can still drop in the chat. Okay, I may not be able to apply advice on clenbuterol. It's good no danger using it to reduce. I'm not going to comment on that. It's a brand, and I have to be careful. Also, talking about certain drugs, there are different controversies around this. The use of this, though it's said to have been actually indicated, usually indicated for asthmatics, but certain other uses are being outlined here, as I can see. Okay, but in terms of weight loss, I'm not sure if it is recommended, accepted, or depending on the regulations in your own nation. Okay, thank you for the first like. Thank you so much. Try to check studies that have been done on the use of clenbuterol. It's actually even described as misuse for weight loss and bodybuilding. So, Dave, right? I'm not going to be talking about recommending this. Okay, I'm not sure. I'm sure there are regulations. Yeah, it's actually even said to produce life-threatening side effects when used. All right, so I'll study more on this, Dave, and we'll get back to you. I know it's an area of interest for you, but it all depends. No matter the drug you are talking about, it all depends on the regulations around it in your own nation, your country. And so it's very important to follow those regulations. There are definitely over the counter medications, there are prescription medications. So we need to identify where this belongs and regulations around its use. Okay, so and if you are involved in certain things like athletes, for example, there are regulations around use of some substances. This will play a big role in their career. Okay. So thank you for joining me. We're going to close it up here. It's been about an hour. We talk about headaches, the different types, the causes, the other symptoms that may be associated, the risk associated with having a headache with other symptoms, the red flags, and then we talk about the treatment. Definitely, depending on the cause of the headache and then the type, also, medications are definitely available. Like over the counter medications are available. I don't want to mention them on this platform right now, okay? But there are analgesics that can be taken to take care of pain, to deal with the pain. But the underlying cause still needs to be identified. And then, importantly, if there are triggers, they should be avoided, they should be removed. And then the emphasis on rest, sleep, and these are very important aspects of dealing with a headache. Thank you for joining in. I'm sure you can check from the beginning. If you didn't join us from the beginning, you can check some of the foundations that we laid on this topic. And I'm sure you can also learn more and share with others. So I appreciate everyone who joined in this session. Looking forward to another session and watch out for upcoming videos. There was a new video I dropped earlier this week. Okay, you can check it out if you are yet to watch it. It's very interesting talking about sexual health. Thank you. Bye for now.